I'm Rachel Felix. I'm the Chief Marketing and Growth Officer at Boston Medical Center Health System. My role at BMCHS is really designed to elevate the brand and help connect and drive all audiences. This includes our patients, donors, community members, and all of them intersect at our mission. And that's ultimately what we're here to do, is to drive better outcomes for our patients. I grew up in Detroit, Michigan, and I spent most of my adult life in Chicago and then New York City. I moved to Boston as a trailing spouse, so I came here for my husband's job and then found a job that I loved. I came to BMC after transitioning into healthcare and finding myself more and more interested in mission-based work. I really wanted to be in a place where we were serving people that looked like my family. I really wanted to work with people that had really diverse experiences and interests. And of course, BMC is the only place for that in New England. My mom definitely had the most influence in my life. She worked her way up from virtually nothing and had a really successful career, raised her kids, and it's an example that I follow today. I learned so much from her about having a strong work ethic and also being compassionate, and I try to carry that with me in all the things that I do. She also has a lot of fun in life, and so I make sure to mirror that as well and work hard, play hard. There are a couple strategic priorities for me this year. The first is to really take a look at our system and how we might better connect and relate to one another. We have a lot of brand equity, there's a lot of brand affinity, there's a lot of value in the brands within our system, and trying to build and grow off of that. The second is taking a thoughtful approach and an analytical approach to how we connect with our audiences, really understanding them, their behaviors, their motivators, and building our story for a philanthropic audience, for the community. We have done so much work, and I look forward to really continuing that and connecting with them and our patients. The most important change that needs to happen to improve health equity is to improve economic mobility. I really feel that without ownership, without jobs, we're really not changing the trajectory of people's lives and health, and I'm so thankful that BMC is invested in improving economic mobility for our patients and beyond. The most rewarding part of my job is seeing the patients we care for, people that may not otherwise get care, knowing that we help to reach them, to help bring them here, and continue to help them even outside of our walls in the work that we do in the community and beyond. That is really rewarding for me.